Welcome everybody to the latest great episode of Heighten Your Sixth Sense. I got Miss Dana Sherwin here. She is out of New York. Just welcome to the show. Just happy to talk with you again. I know we talked, I guess it was about 2 months ago now, and had a really great introduction conversation. So how's everything been going for you in your world?
Good, Sean. Thank you. It's really a pleasure for me to be here to speak with you about, a topic I'm very passionate about, and that is, being a patient and what that takes to be able to engage in your care and have better health outcomes. And that's sort of what my work has been about. And it's interesting because every day I find out something new. So I'm excited to share it with people.
Yeah, I feel the same way. I always, every day I'm always in a state of trying to learn something new. Could be some minor, it could be some major, but it's always about trying to, I guess, better yourself and grow as a person, for your, I guess, for your group, for the people that you care about the most. So tell a bit about you. I know you're a healthcare management expert, patient advocate who's developed a transformational framework to help people communicate with more effectively with their doctors. She's here to share valuable insights on how you can take charge of your health through better patient physician communication. I know that's your focus and your drive and your passion. I know you when we first talked, you told me about some of the things you went through that led you to wanted to figure out a different way to make the communication between patients and doctors, but also it was about the communication between the different systems that the different doctors use, and that's the thing people probably don't even think about. And I thought that was very interesting. I never even thought about that before. That like from state to state, and maybe from city to city, hospital to hospital, the stuff don't really transfer over properly.
Yeah. So my story is probably not that different from other people in healthcare who have become sick and have been working in the healthcare field and
Mhm.
then come sick and have to be a patient in the system. And for
Mhm.
me, I had a fairly healthy, childhood in my 20s and my 30s, but in my 40s, certain things started going wrong. But
Mhm.
they were sort of minor things. I had minor symptoms, and one of the look back is that I didn't have a primary care physician to help, set a baseline for how things were going for me, for my health. And so I found out about a chronic blood disease that was genetic in its origin because I had a blood clot in the portal vein of my liver and I was in
Oh,
pain. And the doctor spent about 2 weeks doing tests until it was identified. And then I was immediately hospitalized and they diagnosed it as a myeloproliferative neoplasm, which is a blood cancer. And it was genetic in nature. And it's where at first your body doesn't produce but your body produces too much red cells, white cells, and platelets. And then the disease morphs into there's not a lot of blood in your body. So, because mine started with I had more blood than I needed, they were able to do treatments, and I was able to live a fairly normal life for about 20 years until which time my health crashed because it morphed into the part of the disease that there wasn't enough blood in my body. And you really
oh,
can't live that way. And there was no cure for this disease but for a stem cell transplant. So I go
oh.
back to, I spent a 30-year odd career in healthcare administration, working at many different healthcare settings. And I didn't pay enough attention to my own health. I mean, I had two kids. I paid attention to their health. I helped take care of my parents, but they were mainly very independent. But I didn't pay enough attention to my health. And so when I got sick, I was really so sick and had to undergo a stem cell transplant. And I had to leave work suddenly. My career ended. And it took a couple of years for my recovery for me to realize that what was I doing right and what was I doing wrong as a patient? Because I had that interest in healthcare generally, and that didn't go
Yeah.
away. And I had such good doctors that really were very informative and helpful. And one day a doctor said, my main hematologist oncologist said to me, you're a really good patient. And I said, oh, that means my health, I'm recovering well. And she says,
Mhm.
no, I didn't mean that. What I meant was that you come prepared for every appointment. You ask good questions, you do research, you have great follow-up. I said to her, well, doesn't everybody do that? And she said, no. People don't. So it
Mm.
clicked in my head. She inspired me to start researching this topic of patient-physician communication. And I've been on this sort of journey for the past 2 years. And I've developed body of knowledge and resources on this topic that I believe could be very helpful to people in giving them a pathway whether they're either facing a doctor once a year or once a month.
Have you ever really incredible and inspiring, story, everything you went through over through that whole time frame from, having a career in the healthcare space, and then, your healthcare taking a turn, and then you have to leave your work and your expertise, your field, and then just going through all of that, the different treatments and stuff you went through, and then through that you learned to develop a system to, help the communication between the patient and the doctor. So it's really inspiring that you took something, a lot of pain on your end and struggle, and you turned it to something positive. So that's really great. What are some of the biggest communication barriers patients face when speaking with doctors, and how can they overcome them?
Right. So, one very big barrier, which we talked about a little bit, but also is being prepared for appointments.
Mm,
Because part of the preparation for appointments, which because nobody likes seeing doctors, so everybody comes
mm,
in with some level of fear and anxiety. I don't want the doctor to find out there's anything wrong with me. I know that was how I was
mm.
viewing it. I had a lot
Yeah.
of illness in my family. I felt okay. I didn't want to know if anything was wrong with me. So I really went into appointments with blinders on in my 20s and 30s.
Hmm.
And so it's important to prepare by saying, what are your priorities? What do you want to discuss with the doctor? What are you interested in learning about? Or what are the things on your agenda that you want more information on? And that includes preparing questions in advance for the doctor. Even with an annual visit, you want to know, okay, what's going to be included in my annual visit? And how am I going
Hmm.
to be monitored going forward? Or I have these genetic conditions in my family history. What's the likelihood of me having them? So when you come in prepared, and I also recommend that you write things down by hand and have a notebook. I mean, some people
Hmm.
like to use, their phone and take notes, but really the way to keep like a compendium and a history of all your doctor's appointments
Hmm.
so you can refer back to it and it's your resource and your history. Writing things down then just takes the angst away from I'm going to forget. So
Hmm.
another big obstacle is people forget what their doctors tell them. They'll leave the appointment and they won't remember anything. So if you don't write it down, you don't write down
Yeah.
what the doctor has suggested or follow-up actions or things about the diagnosis or things about your medication. If you don't write them down, you forget about it. There's only so much you can get from a electronic medical record or through a patient portal.
Hmm.
It's limited. It has a huge amount of information, but it doesn't have information about questions asked or the discussion
Hmm.
or things that the doctor may have suggested. Maybe it does. Some doctors, look, it's a very arduous process for doctors to write down every single point of discussion into the
Hmm.
medical record. Some
Yeah.
doctors do a better job than others, but I know that my doctor has said that it could add up to like 2 hours to her day doing summaries of all the visits that she's had that day. So really, you
Wow.
have to be
A
the
lot.
one, the patient has to be the one to be in charge.
That's a lot. That's a lot. You think about it, if a doctor sees 10, 20 people, patients a day, and then times that with all this something, really gathering all the information and really doing extensive file on that could be overwhelming for them. Yeah. So I think,
Yes.
I mean, it does make sense for the patient to have, come prepared and come, with questions, with something to write. And another thing I was thinking about when you were talking about writing everything down, you can always, have like a recording, like on your voice memo on your phone, have that going while you talk to the doctor so you can remember everything that was said. And then you can go back and maybe make a summary of it and make some notes that way. That might will help some people.
Absolutely.
Can you share like practical strategies patients can use to actively participate in the shared decision making with the physicians?
Yeah. So one is, as we've talked about, coming in prepared, and it is a process. So you're
Mm.
learning about whatever like disease category or whatever is happening to you, either for the short term or the long term, and
Mm.
you're engaging with the doctor with the questions that either you've prepared or that come to you while you're sitting there with the doctor, which is another reason why when you write down your questions, you have them and you don't have to
Mhm.
even remember them because they're right there. And then
Yeah.
while you're engaging, you could ask other questions as well. And then, those three questions we just discussed when we're talking about the treatment plan,
Yeah.
very
Preparing
important
for
to know, what symptoms there may be, what you should always ask the doctor, what I should look out for, or what kinds
it.
of follow-up treatment am I going to have? So it's for you understanding. And if you are not ready, look, doctor, I'm not ready to make a decision on that right now.
Mhm.
Is that okay? Can we set up another appointment for next month so I could take time to go back and learn more and do my own research?
Yeah.
Or say to the doctor, this is really complex for me. I need to involve a family member, or this is really complex and I've read a lot already, but I feel like I need a second opinion.
Mhm.
Say that to the doctor. Most doctors understand, particularly the ones in those categories where second opinions are most common, to
Mhm.
say to the doctor, this is really, I just need to think more about this and I would want to get a second opinion. Is there anyone you would recommend? Because you want the second opinion doctor to be able to be a good communicator with the original doctor. So that's very, very
Yeah.
important as well.
True. I saw something like if you're going to say like a more a doctor that's focused on a certain area, you probably wouldn't want to go talk to a doctor that's more general. You want to talk to another doctor that focuses on the area that you may be getting treatment with. I think that will
Yes.
make the I guess the dialogue between the doctors better because that one doctor may have more specialized knowledge versus the other doctor may have more general. So that's another thing people can think about as well. You want to make sure that who you're sharing information with, the next person, has the same knowledge or close to the same knowledge as the person, the first doctor, because it may cause a confusion in the dialogue, I would think.
Yes.
So that kind of leads to my other question. I was saying, thinking that my other question was like, how can people be more prepared for appointments? But basically, by having the questions prepared and have and just being something to write with, having something maybe record that all those different steps, and then all the questions that you brought us a minute ago, those are really going to get that patient really prepared for that appointment, so they can get the most maximize the appointment to the fullest. Yeah, because you say you only get 5-10 minutes sometime with the doctor at best.
I hope
You know,
not. 5 minutes?
yeah,
Five
we got
minutes?
15. Like 'cause normally like the first, most time you talk to the nurse first. The nurse come in or the medical. They'll do all the basic stuff, and then
Mhm.
the doctor come in. So, that's kind of what I was saying.
Well, so it's so interesting if you're at an academic medical center, you have an appointment with a doctor who works out of academic medical center, and the nurse, like you said, someone will come in advance to do your medication review or how you're feeling, or you have any particular pains or problems. And then sometimes a medical resident or a fellow will come in, and those are, the doctors in training, fellows and residents. That's post-medical school, and they do
Yeah.
know a lot, and particularly if it's a specialty. What I have found, because I'm in the hematology oncology world, and
Mm.
the people, both residents and fellows, who go into that are very well trained and experienced. And I will purposefully ask the most important questions to these residents or fellows to see what kind
Mm.
of answer that I get. So I know I'm going to discuss it with the doctor as well, but sort of to get a different take. And sometimes they explain it better than the doctor
True.
does because they're so fresh
Yeah,
to,
different perspective.
learning about it. And if
Mhm.
they don't feel comfortable asking, they'll say, yes, that's a good question to ask the doctor, and I'll defer to the doctor asking the question. But it's another set of very trained eyes that and
Mhm.
knowledge that you can
Yeah.
use to further your understanding of particular issues. Or if you have something from the last visit, like I can't remember what that blood test means. I was high. What does it really mean? And you can ask the resident or the fellow that question, and you can get some of
Mhm.
the easy questions out of the way
Yeah.
so that you reserve the harder questions for the doctor when they walk in the room. So as you
Yeah.
can tell, I've thought a lot about this because I've had a lot of follow-up care post my stem cell transplant.
Yeah. I understand. Like I said, you're an expert at this in a sense because you have so many hours, towards your own care that you really build up a really I guess, vast knowledge and understanding of how everything works and how it should work. So that's really great. And so one thing I was thinking, like, what role does health literacy play in the patient's communication? I think you brought that earlier about the communication and learning the
Mhm.
language, and how can people improve their understanding of like medical information?
So, health literacy is about being able to, read whatever's clinical information or reading a form
Mhm.
or a consent form or just reading about your disease. And I really believe that people just need to do the best that they can do according to their ability. When they
Mhm.
don't understand something, they can ask somebody else. And most places do have resources, and there are resources on a website as well. So, in addition to health literacy, though, there's that just category of, medical knowledge about your own condition. So, I will always say, know how to pronounce your diagnosis and know what it means, be able to explain your diagnosis and how it affects you, to really have a good
Mhm.
understanding of that. And I think that most people are able to do that. And knowing and all the medical knowledge includes your medications, how to pronounce the name of a medication. So when
Mhm.
someone's doing a doctor or nurse is doing that medication review, it's not like you're not sitting there, oh, I don't really remember. Like you know what medications you're taking, you know how to pronounce the
Mhm.
name, you know you have to take it with food or with water, you know which have to be refrigerated, you know how many times a day, you know your dosages. You need to be the knowledge broker for you, for your health. So when we talk
Mhm.
about, well, health literacy and medical knowledge, I mean, you do what you can, but understanding the language of your own health is probably the even more important than health literacy, because when you understand the language of your own health and your diagnosis and
Mhm.
other aspects and treatments, then you can really participate in your care. And if you need
Mhm.
help with anything, you should ask for help. That's always very
Yeah.
big on my list when I share with people. Don't
Mhm.
be afraid to ask for help or to say that you don't understand something.
Yeah, that really makes a lot of sense though. I like what you said, the knowledge broker. That's a good term. So you're right though. If you don't know how to properly communicate like the words or have an understanding of what it is you are being treated for or what is going on with you, you can't really communicate effectively with the the doctor or the fellow or the nurse that's that you're going to be communicating with anyway, or even say you're trying to explain something to your children or your spouse or whoever. You should have an understanding of it, and then it's going to cause confusion anyway if you don't understand it yourself to explain it to somebody properly.
Exactly.
So how do you feel caregivers and family members support effectively communicate between patients and doctors, especially in like complex and chronic like health conditions, people go through.
Well, I've talked on this subject to doctors directly and say, what can patients do if they're really like nervous or they feel
Mm,
they can't absorb all this information? That most of the
mm.
doctors tell me, I'm okay with them bringing a family member into the visit so the family
Oh
member
yeah,
can listen, take
that's good.
notes, record, be involved. And I also think,
Mm,
in between appointments, family members can have discussions with the person that is sick and say, let's talk about what appointments are coming up. Let's talk about how your medication is going. But there's a great range for people who could do, self-care, and then someone who needs to be totally taken care of. Is a great
mm.
range. And I think it's important to encourage people to do as much as they can for themselves to their capability, because it gives them
Definitely.
a feeling of being more in control and more independent. Like people who can take their medications on their own should be encouraged to do that, set up good systems to take medication. I was fortunate that I always had sort of presence of mind. I might not have been feeling well and I might have been had very low energy, but I always felt
Mm,
like having my routine to take my medications,
mm.
to check my blood pressure, to check my sugar levels myself. All that gave me a great feeling of independence,
Yeah,
knowing
that's a
that
good
I
thing.
couldn't, that my 30-year career was not going to continue, that I
Mm,
needed to then establish a life for myself and a good recovery. It made me feel like really that I was taking more in control. I was more in charge of my day-to-day life and my health. And that gave me so much really like courage to keep going. So, because when
Yeah.
you do little things for yourself,
You build
it
confidence. Yeah.
bolsters you. You feel
It builds
good
confidence in the
about
thing.
doing that. No
Yeah.
matter what it is, you could take a short walk or you do
Hmm.
some chair exercises or whatever stage you're at. It's like you are doing things for, your health and to make yourself feel better. Because really,
Hmm.
ultimately, it's about, quality of life and feeling good and having energy and feeling like I'm
Hmm.
taking care of myself because I have the courage to do so.
Yeah, that's good. You're right though. Like the more you can over time, you might not be in the best situation. So for like energy and all of that, and just what you feel in general. And so as you taking those steps of doing the small things for yourself, you're just gonna over time you're gonna build the confidence, the esteem. You may get your energy back. You'll feel better about yourself overall in general. So that's a really great thing. So I was thinking like I was looking at your website, the Thinking Patient. I kind of want to know a little bit more about that and like how does that help people? Like what was the like what I understand the motivation why you did it. So just kind of I want to know more about your whole platform.
Okay. Well, I've developed this sort of body of knowledge and also like different strategies and approaches. And I thought that the best way to get it out there was through, organizations and employers who really either like employers pay for the health of their employees or
Yeah.
organizations that are processing people through a the healthcare delivery system. So in order to get my message out to as many people as possible, um, I thought it was important to work directly with organizations and employers. So that's how I am right now, how I'm disseminating information.
Okay. So it basically it's like it's your the way you can broadcast your information out and it's all in one place. It's organization of all the great information that you are sharing with everybody to make the communication between patient and doctors better. That's a great thing. That's a great thing because I think people are so busy and overwhelmed with just basic life in general. Anything that's gonna make the steps easier is a good thing. And the ease is what people are looking for anyway. Something that's gonna make take a little stress off of them in some kind of way. So that's really good.
Absolutely. I think you hit the nail on the head.
Hmm.
So there's always going to be stress and anxiety with seeing
Yep.
physicians and taking care of your
And that,
health. And that will
yeah,
exist, but you want to lessen it. You want to give
mhm,
people a pathway so it could coexist. The stress coexists with proactive and productive action that you can take as a
mhm.
person to have a relationship with a physician and have a partnership with a physician or
Yeah. Now
multiple
you're right.
physicians in my case.
Now you're right though. I mean, targeting the organizations of the is the best way because they already have systems in place already, and so the people are the organization, so they'll be able to disseminate the information to the people through the organization that they already have. If they just combine or merge what you are doing with what they're already doing. So
Exactly.
it's
Yes.
the right. I would definitely feel like the right path. Yeah, definitely. What are the key takeaways you will offer to someone looking to become more engaged in their healthcare and advocate for themselves more effectively?
I think that knowing that everybody goes through this, it's a part of
Mhm.
life, taking care of one's health, or if you're taking care of, a loved one, if you're
Mhm.
guardian of somebody, it's important to know that, yes, there are challenges, but if you learn as much as you can and you're curious
Mhm.
and you put into action what you've learned, that working with doctors will come much easier. You'll be able to be engaged in your health and have the prospect of having better health outcomes. So it does take a focus, it takes some
Mhm.
skills, it takes knowledge, and it takes courage. But when your courage builds after a certain amount of time, things
Yeah,
get
it will.
easier to do. You
Mhm.
and the courage reinforces the fact that you're doing the right thing for yourself.
Really good. The courage is gonna manifest and grow to a higher degree as you do more for yourself. And also the
Absolutely.
knowledge, like I said, and when the knowledge too, the knowledge is going to make you feel confident, have courage to, ask the questions and do the steps that you need to do.
Absolutely.
Very important. So I know we're short on time. I know you have to get out of here. So like what like well like where can people other than your website, thethinkingpatient.com, where else
Mhm.
can they follow you and get in contact with you and know more about what you're doing?
Yes, thank you for asking that. I post weekly on LinkedIn. I have content that's related to physician patient communication, and I usually focus on topics that are of interest to me that relate to having better communication with doctors. And I do research and I write about those topics. So I've been doing that for about a year and a half now. And so there's a lot of content on LinkedIn under Dana Sherwin. And people can contact me through my LinkedIn connection as well.
So LinkedIn, your website. Okay. So are you like going around? You doing any speaking, like TEDx's, or are you doing anything like that?
Well, I am thinking about TEDx's, but
Mm,
I did had a I was a speaker at a conference at the end of January that was composed of employee health plan professionals, and I talked about engaging the workforce in their health and their
mm,
health care and how to do that. And I've done similar things in the past, and I've also done a lot of community workshops,
mm.
direct to consumers, meaning people in the community who are interested in the
Yeah.
topic, and gotten a lot of positive feedback. And people have told me that people who are already very look who would attend one of these workshops, people who already want to
Mm,
really focus on improving their health and their relationships with doctors. But I've learned a lot from the people coming to these workshops in terms of really what's going on out there. And it's just so complicated that the more that an individual person can do to take control of their health and the information and working with doctors, the
mm.
better position they'll be in to do what they can for their own health.
That's well said. I love your passion and your drive for what you're doing. It's you can hear it, you can feel it in your energy and the way you speak about it. So that's really good. You're really doing great things for for your local community and nationally. So that's really great. And I just really appreciate you reaching out to the show and coming on and it's great second time talking to you and hopefully in the future we can collaborate and connect and down the road. So I'm really looking forward to the next time.
Happy to do that, Sean. It was really my pleasure. Thank you so much.
Thank you. Y'all, this is another great episode of Heighten Your Sixth Sense. Got Miss Dana Sherwin here from New York, and I'm just happy to have her. And we'll see you guys on the next episode.